What's going on, Team Symmetry YouTube community? Welcome to part one of our Bulletproof Lower Back program. So real quick background, I did suffer a lower back injury in 2012. I was playing college sports. I had a bulging disc in my L4, L5 region, and the goal of this series, the 10-part series, is to help alleviate any pain folks are having with their lower back, whether it be tightness, or whether that be shooting pain or tingling. It seems to be a common ailment that a lot of us experience, whether we're doing CrossFit or if we're just the average desk worker or someone moving about their life. At some point, you will experience some lower back pain. So I have gone from this place of where I was so injured I could barely touch my knee to now I'm able to do CrossFit. I'm able to pick things up. I'm Olympic lift, do gymnastics, play sports. And it doesn't really bother me. So the point of this series is to let you know as the viewer how I got there. So we're going to start things out, especially today, with one of the most basic moves and something I tell a lot of folks who, if they're suffering from lower back pain, and maybe that's tightness, maybe that is actual shooting pain, is something called a press up. So this is also seen in yoga as a cobra. So what we're trying to do here is alleviate what we'll talk about a lot is our hip flexors or our psoas muscles. So as I get better at YouTube here, folks, I'll have a little bit more editing skills. But for today's demonstration, we have the psoas, which is here in red. And a lot of times if we're sitting just like I am, all right, we as humans are going to adapt. If I'm leaning over and if I'm sitting at my desk, what have you, I might tend to have my psoas muscles tighten up a lot. They will shorten, as will your hamstrings if you sit at a desk long enough. And what that does is eventually that tight muscle is going to end up pulling on our lower lumbar, our lower back region. When our muscles are pulling on that, something eventually gives, and a lot of that's either in a bulging or herniated disc, and that's where you might start to experience some of the tingling and numbness or any shooting pain. You might feel your hip flexors and your hamstrings lock up. So to the press up, how do we perform that? Well, we're going to go ahead and lay in a prone position, so on our stomach, just like so. So the goal here is we're going to press up through our arms, breathe out at the top of this movement, and you'll notice we're really stretching along this psoas muscle here. So you can breathe out at the top and then come back down. I wouldn't hold that top position more than 3 seconds. So I'm really focusing on pushing through my arms, pushing through my palms into this position and allowing that decompression to happen. So what we're doing when we do that is we're realigning our spine a little bit, allowing those discs to fall into place here. So by doing so, we'll experience a lot of stoppage of like any of the shooting pains. We'll start to have a lot more mobility within our psoas, and you'll notice you'll be able to kind of, especially if you experience a shooting pain or a bulging disc at this time, you'll notice yourself kind of be able to function a little bit better. If you are experiencing this pain, I would do this about 50 times a day, about 50 press ups. Break that up as you need to. I know that's a big number, but that's a great place to start. Now, more than anything, I want folks to know I am not a doctor, I'm not a physical therapist, I'm just someone who's experienced a lot of lower back pain, and this is the strategies and some of the things that have helped me out along the way. So I hope you enjoy this part one of this series. This video is a little bit longer than what most of them will be. Hopefully they'll all be about 2 to 3 minutes in length, but stay tuned for more. Hope that helps, and have a great day. Thanks, folks.